I'd like to welcome you to BeMoreNews.com, the news before the news, where we uncover the truth. We're here at Total Healthcare in the pharmacy at 1501 Division Street with Dr. Caroline Akinlosotu. How did I do?
Very good.
Very
Thank
good.
you.
Good. So what do you do here at the pharmacy?
I am the clinical pharmacist at Total Healthcare.
Okay. And you're involved also with medication therapy management.
That's correct.
What is that?
I'm glad you asked. Medication therapy management is what some may call a medication checkup, a service provided by our clinical pharmacists here at Total Healthcare.
Okay, because I would think that over time, especially as we get older, maybe even specifically for seniors, they're being bombarded with a plethora of
Yes,
different medications to take.
exactly.
So yeah, we have to check to make sure that nothing is hurting the other and countering each other.
Exactly, very true. Medication therapy management, or some will call it medication checkup, is more than the few questions being answered while picking up your prescription at the pharmacy. It's more of a one-on-one, it is actually a one-on-one consultation with your pharmacist to review all medications, which includes prescription medications as well as over-the-counter medications, herbal products, and even dietary supplements.
Okay, and who should take advantage of this service?
Well, even if you don't mind, before I talk about who would get this service, I would like to talk about what they can get from this service.
Okay.
And what our patients can get from this service are they will have a better understanding of how their medications are being used to manage their health conditions. And when I talk about health conditions, I'm talking more about the chronic ones such as hypertension, diabetes, asthma, high cholesterol, and whatnot. Help organize their medications. Patients are non-compliant or non-adherent to their therapies for many reasons. We'll be able to talk about that. Help identify any problems they're having with their medications, and if at all there are any problems, work with the patient and the physician to resolve these problems, and compile a handy list of medications for patients to share with other healthcare providers. Many a times patients don't know what medications they're taking. That list is something that they can share with other healthcare providers to prevent duplicate medications being given.
So I would think everyone needs this service.
Well, I'm sure anybody taking any medication might feel this might be worthwhile, but studies have shown that this service is most helpful to patients who get several medications,
Okay.
who have several health conditions, patients who are looking to reduce their out-of-pocket medication costs, patients who visit more than one pharmacy for their medication, those who've just been recently discharged from a hospital, they're coming out on several meds, not quite sure if to take that in addition to the old ones they were taking prior to going into the hospital. Patients who are taking medications that require frequent lab monitoring. Patients such as these do get the most out of this
Okay.
service.
Okay. When it's a lot to manage.
Yes.
Okay. All right. Okay. Good. And no doubts the benefits include life, better
Yes,
life, healthier life,
in
longer
addition,
life.
in addition to fewer emergency room visits, studies have shown this. This is not just facts we're making up. Studies have shown patients who utilize this service with their pharmacists have fewer trips to the ER, fewer hospitalizations. They do understand how to take their medication. They're able to better manage their health conditions, and there are fewer problems caused by medications.
Okay. Dr. Akinlosotu, any final thoughts?
Just this, we highly encourage patients to come here. This is a free service being offered to our patients, and we look forward to seeing everyone.
Good deal. Thank you for your time.
Thank you.
And keep watching BeMoreNews.com, the news before the news, where we uncover the truth.